All right, Talk Ticker fan, welcome back. Today, we're strapping in for a deep dive into CVS Health's Q3 2024 earnings call. And spoiler alert, it's a wild ride.
Yeah, this one's got an all-new CEO, a whole leadership shuffle, and they're even skipping formal guidance. Not your average Tuesday, right?
Definitely not. So first things first, Karen Lynch is out, David Joyner is in, but this isn't some random newcomer.
Exactly. Dude's been with CVS for 37 years. Started at Aetna, ran Caremark. They didn't pick this guy out of a hat.
Exactly. So what's the read on this then? Big change at the top? What's that telling us?
Well, I think, timing matters, right? Aetna's been having a rough go. This leadership change, it's got to be connected to that. It seems like the board wants someone who can, fix things, get their hands dirty.
Makes sense. And speaking of Aetna, they brought in Steve Nelson to run the show over there. Former CEO of United Healthcare, not messing around.
Nope. And Prem Shah, who was already running pharmacy and consumer wellness, got a promotion group president. Now he's got health services too. These aren't just let's move some shares around kind of moves.
So what are they saying with these moves then?
Priorities, Nelson. They need Aetna fixed, and they need it fixed yesterday, Shah. CVS wants their pharmacy strengths to prop up the whole healthcare business. They're going for that we do it all strategy.
Gotcha. All right, let's talk numbers. Overall, it's a bit of a mixed bag. Health services, that's Caremark, Signify Health, Oak Street Health, they're killing it. Delivering on cost savings, growing their healthcare delivery, that biosimilar strategy is really working out for them.
Big time. Biosimilars, they're like generic versions of those crazy expensive biologic drugs, right?
Yeah.
CVS is pushing this hard to drive down costs. Clients who went with this saw their commercial specialty trend drop to just 1.3%. That's almost unheard of.
Wow. Okay, so health services is good. Pharmacy and consumer wellness, also good. Gained market share. They're providing those essential health services in the community. And they hit a record high retail pharmacy script share of 27.3%.
Yeah, they're executing well, especially considering how tough the retail market is right now. But then we get to healthcare benefits, specifically Aetna. And that's where things go a little sideways.
Yeah, that was rough. Elevated utilization, especially in Medicare Advantage and the individual exchange, that really hurt them.
Right. And they pointed to, a few things, right? Miscalculated pricing, maybe those benefits were a little too generous, and that membership growth, it just exploded faster than they could handle.
Okay, so is this a blip on the radar or a deeper problem?
Honestly, that's the million-dollar question.
Okay.
And it feeds directly into why they're skipping formal guidance this time around. Joyner basically said, look, we got to fix this mess before we start making promises. It's the right move, probably, but it definitely raises some eyebrows.
Absolutely. All right, let's break down the challenges one by one. Starting with Medicare Advantage. They basically admitted that medical costs were higher than they expected, and those generous benefits, yeah, they attracted members, but also pushed utilization way up.
Oh, and then there's the star ratings, the elephant in the room, those disappointing 2024 ratings, that impacts their reimbursement from the government. Not good.
Okay, so that's Medicare Advantage. What about the individual exchange?
Similar story, fast growth, but it came with a hefty price tag, especially in certain areas. And they got hit with some negative risk adjustment updates.
Risk adjustment updates.
Yeah, basically it means they way underestimated how much they'd have to spend on patients who were, sicker. It's not just about money. It's about their ability to, even assess risk accurately going forward. Big concern.
Gotcha. So we've got those two, and then on top of everything, Medicaid's also facing pressure from all those redeterminations, people getting kicked off, right? Yeah.
Leading
to higher acuity. That's hurting margins.
Yep.
It's an industry-wide trend, but it's not helping CVS situation at all. They're kind of getting it from all sides.
So not exactly a rosy picture, but they are trying to turn things around, right? Focusing on profitable growth.
Right. Got to give them credit for that. They're overhauling Medicare Advantage, new benefit design, new pricing for 2025. They even said they expect to lose 5-10% of their members.
Yeah, we talked about that earlier. Sometimes you got to shrink to grow.
Exactly. They're basically saying, look, we'd rather have fewer members who are actually profitable than a ton of members who are costing us money. Smart move, long term.
Okay, and individual exchange, what are they doing there?
Same idea, price adjustments, product tweaks, all about profitability, even if it means fewer members overall. It's a course correction. They're admitting they grew too fast. Now they got to find a sustainable path.
All right, and last but not least, that cost savings initiative. Over $500 million in savings in 2025. Ambitious. Did they say how they're going to do it? They were kind of vague on the details. Optimizing workflows, leveraging tech, streamlining processes, the usual suspects. But let's be real, that stuff is way harder to actually pull off than it sounds.
For sure. But if they can make it work, that's a huge boost to their bottom line.
Absolutely. And it's not just about cutting costs internally. They're also trying to create a more efficient system overall. That CVS Cost Advantage program, remember that? They said it's going to cover more than half their commercial pharmacy scripts by next year.
Yeah, that's a big deal. Just refresh our memory, though. What exactly is CostVantage again?
It's all about tackling those crazy fluctuating drug prices, trying to bring some stability and transparency to the whole system. Could be a win-win-win for CVS, the PBMs, and eventually us, the consumers.
Okay, so it's not just about tightening their belts. It's about finding smarter ways to do business overall.
Exactly. And it might even help smooth over those relationships with the PBMs that have been, let's say, less than stellar lately because of pricing disputes. It's a strategic move, for sure.
All right, well, that's a pretty good overview of the situation at CVS Health. Lots of challenges, but also some potential bright spots.
Yeah.
It'll be fascinating to see how this all plays out.
Yeah, buckle up. The next few quarters are going to be interesting, that's for sure. So let's dig a bit deeper into these turnaround plans, shall we? Starting with Medicare Advantage. They're completely overhauling their benefit design and pricing for 2025. Remember, they said they're bracing for a 5–10% drop in enrollment.
Right, we talked about how that could actually be a good thing, long term. Still, a pretty big move, though. What makes them think they can pull this off?
It's a balancing act. They need enough members for scale, but they gotta be the right members. The profitable ones. It's not just about how many people they cover, it's about the quality of that membership base.
They mentioned something about improved star ratings expected in 2025. How much of a difference is that going to make?
Big difference. Higher star ratings mean higher quality scores, and that translates directly into higher reimbursement rates from the government. So, win-win. Better care for members, more cash for CVS.
Got it. So, Medicare Advantage, we kind of get that now. Let's shift gears, talk about the individual exchange. How are they planning to fix that mess?
Same basic playbook. Price adjustments, product changes, focus on profitability, even if it means shrinking their membership base.
So profitability over growth. That seems to be the theme for both Medicare Advantage and the individual exchange. Can they make that work long term?
I think it's more of a correction, right? They grew too fast, too aggressively, and now they got to step back and figure out a sustainable path. Play the long game.
Okay, so that's the strategy side. But what about the actual execution? They mentioned that cost savings initiative over $500 million in 2025. Did they give any details on how they're actually going to do that?
Not really. They were pretty vague on that. Optimizing workflows, leveraging tech, streamlining processes, the usual corporate buzzwords. But the reality is it's a lot harder to actually do than to talk about.
Oh, absolutely. But if they can pull it off, that's a massive boost to their bottom line.
No doubt. And it's not just about cutting costs internally. They're also looking at ways to make the whole system more efficient, like that CVS Cost Advantage program we talked about earlier. Remember they said it's going to cover more than half of their commercial pharmacy scripts by next year?
Yeah. Just to refresh everyone's memory, though, what exactly is Cost Advantage again?
So it's their way of dealing with those crazy drug price swings, trying to create more price stability, more transparency. Could be a win for everyone involved. CVS, the PBMs, and ultimately consumers.
Okay, so it's about working smarter, not just harder.
Exactly. And it could help them mend those fences with the PBMs, which, let's face it, haven't been great lately. Pricing disputes and all that. It's a smart move, strategically speaking.
Makes sense. All right, let's talk about their healthcare delivery assets. Signify Health, Oak Street Health. How are those performing?
Pretty well, actually. They seem happy with the progress they're making. Signify, especially, is growing like crazy. And they're using it to serve more Aetna members. It's all about that vertical integration.
They also mentioned some positive results from integrating Oak Street Health with Aetna. Something about a 4-fold increase in Aetna members enrolled at Oak Street since the acquisition.
That's huge. It means they're getting better at directing patients to lower cost, higher quality care. It's a good sign that their whole integrated care strategy is starting to work.
All right, so it sounds like there's a lot going on. Challenges for sure,
Yeah.
but also some potential wins. The big question is, will it be enough to turn things around?
Yeah.
To win back those investors?
That's the million-dollar question. Only time will tell, right? But CVS Health, they're a massive company. They've been through tough times before, and they've always managed to adapt.
That's true. And they've got a new CEO who's clearly not afraid to shake things up. Plus, they're still generating a ton of cash flow. Remember they mentioned $7.2 billion in year-to-date cash flow from operations?
That's right. Gives them some wiggle room to invest in these turnaround efforts, weather the storm. It's not like they're starting from scratch. you know?
Right. So maybe there's hope for a comeback story here. I'd be interested to watch it unfold.
Definitely. The next few quarters will be telling, but CVS, they've got the resources, they've got the experience, and now they've got a new leadership team with a clear vision. It's going to be fascinating to see how it all plays out.
All right. Well, I think we've covered the key takeaways from the earnings call pretty thoroughly. We've analyzed the challenges, looked at their plans to turn things around. Before we wrap up, any final thoughts for our listeners? What should they be thinking about as they digest all this information?
I'd say don't give up on CVS Health just yet. It's going to be a tough road, no doubt, but they've got the resources, they've got the motivation, they can do this. The next few quarters are crucial, so we'll all be watching closely.
Well said. All right, folks, that's our deep dive into CVS Health's Q3 2024 earnings call. We covered a lot of ground today: new leadership, mixed financial performance, ambitious turnaround plans. Hopefully you're walking away with a better understanding of the challenges and opportunities facing CVS Health.
And as always, remember, this is not financial advice. Do your own research, talk to a financial advisor, make those investment decisions based on your own situation and risk tolerance.
We'll be back next week with another earnings call teardown, bringing you the insights you need to navigate the markets. Until then, happy investing. All right, Talk Ticker crew, welcome back. We've been breaking down CVS Health's Q3 earnings call, all the twists and turns. And to help us make sense of it all, we've got a special guest today, healthcare industry analyst. Guest speaker's name.
Guest speaker's name, thanks so much for joining us. Always appreciate getting an expert perspective.
Thanks for having me. Happy to be here.
So, guest speaker's name, we've been going over CVS Health's latest earnings, that whole turnaround strategy they're laying out. From where you sit, what are the biggest challenges they're facing right now?
Well, I mean, you guys have already hit on a lot of the key points, right? Aetna's definitely facing some serious headwinds. Medicare Advantage especially, it's a tough market right now.
Yeah.
Costs are rising, competition's fierce.
Yeah, and they admitted to some mistakes, with pricing and benefits. Do you think that's just like growing pains, or is there something more fundamentally wrong with Aetna?
It's probably a bit of both, to be honest. The whole industry, they kind of underestimated how much utilization would jump after the pandemic.
Mm-hmm.
And CVS Health, well, they seem to have been hit harder than some of their rivals. That rapid expansion into the individual exchange market, that didn't help either.
They're making some big changes now, though. New leadership, overhauling benefits, a massive cost-cutting initiative. Do you think they're doing the right things? Is it enough to get them back on track?
I think they're moving in the right direction, definitely. Bringing in someone like Steve Nelson to run Aetna, that shows they're serious about fixing things, and that focus on profitable growth, even if it means shrinking some parts of the business, that's smart. It's the right call in this market.
Okay, so that's the short term, but they're also playing the long game, right? Those big investments in healthcare delivery, Signify Health, Oak Street Health, are those going to be differentiators for them, or are they just distractions?
They could be huge, absolutely. But it all comes down to execution. Can they integrate those businesses effectively? Can they use them to actually improve care and lower costs? That's the key.
What are you going to be watching for in the next few quarters to see how they're doing? What are the signs that they're making progress?
Well, for me, it's all about Medicare Advantage. What happens during open enrollment? Can they stabilize that business, show some improvement in margins? That's going to be a big tell. And of course, I'll be watching that cost savings initiative closely. Can they actually hit those targets? And how well are they integrating those healthcare delivery assets? Lots of moving parts.
Guest speaker's name, this has been super helpful. Thanks so much for sharing your insights with us.
Yeah, really appreciate you taking the time.
My pleasure. Always enjoy talking shop.
All right, Talk Ticker listeners, that wraps up our deep dive into CVS Health's Q3 earnings. We covered a lot today: new CEO, shaky financials, big turnaround plans. Hopefully you've got a better grasp on what CVS is up against and what their chances are.
And as always, this is not financial advice. Do your own research, talk to your advisor, all that good stuff. Don't make any investment decisions based on what you hear here.
We'll be back next week with another earnings call breakdown, helping you make sense of the markets. Until then, happy investing.